If you have got a problem in passing urine, if the urine is stopping now and then, if you get up frequently at night to pass urine, you may think there is a problem in the prostate gland. Then you go to a surgeon who will do a digital examination. That means who will put a finger above your bottom and feel the prostate gland, and if it is hard and if it is enlarged, he'll ask for one more test which is called prostate specific antigen, or the PSA. And if it is increased, if the PSA is increased, then the next test they'll ask for is a biopsy. Now let me tell you what are these prostatic tumors or prostatic swellings. The most important fact I would like to share with you is once you do a biopsy, it may come out as a malignant tumor. Let me tell you, the studies done in major institutions, universities and research studies have shown that if you do a biopsy of a man at after 60 years, 60% of the specimens should show a malignancy. And a biopsy done at 70 years, 70% will have cancer. At 80 years, 80% will have cancer. At 90 years, 90% will have cancer. And believe me or not, if you do a biopsy for a person at 100 years, 100% of the prostates will show malignancy or cancer. Now let me describe you what are these cancers. Okay, what are these swellings which are seen in the prostate. When biopsy is done, it will show adenocarcinoma. So most important purpose of human life is survival, and the survival happens because of repeated or continuous cell division, multiplication, repair and healing. But sometimes this repairing process or a healing process will form the tumors which will extend beyond the human control or the control of the human body, and they will extend into the adjacent prostatic gland, and also it may extend into other parts of the human body, most commonly the vertebral column or the bone, which is called as a metastasis. Now let me explain to you whether we can differentiate these prostatic swellings as dangerous or non-dangerous swellings. For example, dangerous swellings will extend beyond the tumor. They'll extend into the entire prostate gland. They will extend into adjacent lymph nodes, and also they will spread to the bones and other parts of the human body. Whereas non-dangerous tumors will have a nice capsule. They will not spread beyond the particular capsule. Now, as a radiologist doing scanning for these enlarged prostate patients over a period of 25 years, doing almost 100 scans per month, I would like to say 95 to 99% of these prostate swellings are benign or non-dangerous. They may show increased PSA, prostate specific antigen, or they may show even a little bit of moderate grade of malignancy if you do a biopsy. So you can ask me whether it is possible to identify whether these are dangerous or non-dangerous tumors. AI based or artificial intelligence based imaging studies, especially magnetic resonance imaging or multi-parametric imaging of the prostate gland, will specifically tell you whether it is a dangerous or a non-dangerous tumors. And you can ask me how to do that. The characteristics of the non-dangerous tumors, they do not have a capsule. They have increased vasculature because they are multiplying very fast. So they will have increased vasculature. They will take out the entire blood of the human body and they start dividing. And they will have increased cellularity. Per gram there will be more cells, and they also will increase in size rapidly. Though these things can be evaluated by MRI, and we can tell you whether it is dangerous or non-dangerous. These dangerous tumors are again classified into what is called PIRATs, 1, 2, 3, 4, 5. 1 is non-dangerous, 5th is totally dangerous tumors. So we can categorize these into 5 categories. The number 1 category means you can totally ignore. The 2, 3, 4 are ugly tumors. You may have to follow because doubling time or increasing in the size is the most important factor to decide whether it is malignant or not. So we will follow these tumors at frequent intervals if it is 2, 3 and 4, and if it is increasing in size, and if it is showing characteristics of increased vascularity, increased cellularity, then immediately you may have to go for a biopsy and remove the tumor as soon as possible. If it is grade 5, that means it doesn't have a capsule, it shows a lot of vascularity, then it is a dangerous tumor. It has to be removed immediately. Now let me tell you what are the problems with doing a biopsy. As I told you, the human defense mechanisms would have contained all the cancerous cells, would have restricted all the cancer cells by dividing and spreading into various parts of the body by forming a well-defined wall or a capsule. And if the capsule breaks, it will extend into all the other parts of the human body. By putting a needle, you will be breaking the capsule of that particular tumor. So most of the literature, most of the research studies have shown that putting a needle will be breaking the capsule and will be enhancing the spreading of this particular tumor into rest of the human body. So you should be very, very careful before doing a biopsy. We should analyze all these tumors by imaging rather than by putting a needle. Finally, friends, the tumors will increase in size due to various causes. The most important cause is not just the physical injury, chemical injury, but the most important cause is the psychological injury. So we should come out of this mental or psychological stress, anxiety and tension. So when you come out of this stress, anxiety and tension, when you start loving your work. When you start loving your work, when you start enjoying your work, you will be automatically coming out of this stress and tension. Even if you have got a lot of stress and tension, I will suggest you one mechanism. That means you can do, of course, you can do meditation, yoga and pranayama and some physical exercises to relieve stress and tension. And the other thing which you can do is go to a government hospital nearby and spend some time with the people having cancers, especially children having cancers. When you stay some time with them, you will definitely come out of the lot of stress and tension, and you will be very, very happy, and you will live with the love and affection. With these things, I would like to tell you, let everybody be happy, let everybody be healthy. Sarve janaha sukhino bhavantu.